With Dr. Fred von Stieff, and today we're finding out more about the purpose and importance of his book, Brain Imbalance. So Dr. von Stieff, first tell us about what makes your methods in detoxification and treatment for substance abuse unique and so successful.
Katie, I've been doing this for 25 years, and you have to treat each individual with their own neurochemical imbalance problems and treat them properly. Without that, you can't be successful. We have definitely been successful in our treatment plan and treated patients more effectively, and that's the basis of the book.
Okay. For what reason would you say you wrote Brain Imbalance?
Katie, I wrote Brain Imbalance because after studying the brain and studying 25,000 detoxes, I knew that there was a continuous thread of knowledge running between these patients in the neurotransmitter systems and what was happening. It's just as predictable as cardiology, predictable as any other discipline in science. There are rules. I analyzed these rules and wrote them down and put them in a book on the brain.
Okay, so what kind of audience did you intend to capture with this informative book?
It's not only for the patient, but it's for healthcare workers and all the family members, the mothers, the fathers, who have someone in their family who are addicted that do not understand, and they feel guilty themselves for the circumstances and the consequences of their loved one's use. So it's for them.
Okay. Well, that covers a wide audience. So what do you hope to accomplish with this book, Brain Imbalance?
I hope to accomplish a new perspective, a new understanding, a new depth of thought, a new way to help people understand that this goes beyond the psychology, beyond the shame, but there is another answer to turn these people around. But also the family members have to understand the neurochemistry, the genetics, and the real reason why the people continue to use and what can be done. So it gives them a little bit of hope and trust. What happens is hopefully it'll ameliorate or decrease that feeling of anger, guilt, and then also makes them understand that there is a reason for this when right now they don't understand the true reason for it.
Okay. All right, so my last question is, do you have plans for any future books?
Katie, there's always a puzzle of addiction out there. You know, we're taking the pieces and trying to put them into some constructive manner to be able to have people understand addiction. For now, nobody really understands it. It's a mirage of guilt, shame, and also not knowing how to do it. But there are answers. In the future, we will be writing a book on more on how the government, how individuals, how the medical community has placed this thing on a psychological blame system of which there's a lot of money, empowerment, and then also to where people should actually know what's happened and what we have to do in the future to reorganize the treatment of addiction and try to prevent the 26,000 deaths every year from Oxycontin and other drugs, and that little is being done about that.
Okay. All right. Well, thank you for coming in today.
You bet. Good luck with reading the book.
Thanks.